Hi everybody, welcome with Walid Youssef. Welcome to today our pharmacology Neclex review about very important medication, which is Warfarin. Knowing about medication, this is very important for those people who are planning to do Neclex exam, HAD or barometric exams. We will use a beautiful acronym to remember all the information related to today medication. This acronym is NERS, which is N stand for name, U stand for used for, R stand for responsibility of the nurses, S stand for side effects of the medication, E stand for education for patient. Are you ready? Here we go. So, if we are talking today about medication, we call it Warfarin, or it has another famous name which is Comadine. This medication is a part of vitamin K antagonist family. It is an oral anticoagulant. So, if we ask ourselves, what is the importance of vitamin K in our body? Our body uses vitamin K to make clotting factors in the liver. Since this is a vitamin K antagonist, which is warfarin, it will inhibit certain clotting factors in the liver from using vitamin K, and this will slow down the clotting process. This means this drug can help prevent a blood clot from forming in the vessel, or if a clot is already present, it will prevent it from getting bigger and breaking off and traveling into the circulation. So, how this medication will work? It will stop coagulation process by blocking the formation of clotting factors in the liver that require vitamin K to form. Their clotting factors are clotting factor number 2 and number 7 and number 9 and number 10. So, when coagulation occurs, a venous thromboembolism can occur. There are two types of venous thromboembolism. Type 1 is deep vein thrombosis, or we can call it DVT. This is where a clot forms within a vessel. It can break off and travel in circulation. When it is travel in the circulation, we will call it embolism. It will go to another place. Embolism, most type that happen is pulmonary embolism. This is where a DVT broke off and traveled into circulation where it went to the lung. An embolism also can cause a stroke or heart attack. It is important to know this medication or the oral anticoagulant don't dissolve or break up the clot. They just prolong how long it takes the blood to clot. So this medication is differ from thrombolytic medication like STK. So we gonna discuss used. This medication is used for what? This medication is used for long-term anticoagulation, preventing or treating blood clots. Example for that, patient with DVT or pulmonary embolism. So, if we ask ourselves, what condition increase a patient risk for developing blood clot? The answer is post-op surgery, especially knee or hip, because remember the patient will not move his extremity, and it will cause a stasis of blood, and when there is a stasis of blood, patient is at risk for clot formation. Also atrial fibrillation, also same principle. When patient has an atrial fibrillation, this means some of blood will stay in the heart, and stasis of blood in the heart, it will encourage formation of clots, and it will be very dangerous for the patient. Also, heart valve replacement, especially with mechanical valve, myocardial infarction, etc. So, what is the responsibility for us as a nurses when we are dealing with patient on comadine or warfarin. Our main responsibility is monitor for bleeding in unusual places. Example for that: blood oozing at the gum, dark tarry stool, melena, reddish pink urine, hematuria, vomiting of blood of coffee ground vomiting, bruises for no cause, tachycardia and hypotension because it may indicate patient has bleeding somewhere in the body, severe headache which may indicate also bleeding in the brain. Remember, this is very important medication. Warfarin is not for patients who have active bleeding. Example for that: bleeding, GI bleeding or ulcer, surgery, patient who are going to surgery, or renal or liver failure. Because if we give warfarin for those patients, we will increase the risk for bleeding. Patient will be at big harm. So let us continue about our responsibility for us as a nurses. We have to monitor the BT and INR for patient who is on warfarin. This drug has a very narrow therapeutic range for it to work successfully and prevent clot formation. BT means prothrombin time, and prothrombin time is a clotting factor. It tells us how fast the blood will clot. Hence, how fast prothrombin change to thrombin. A normal BT is from 10 to 12 seconds for patient who is not taking warfarin. INR mean international normalized ratio and is calculated from the patient BT result. This is the result we look at it for patient who is on comadine. A normal INR is from 0.75 to 1.25 in patient who is not on warfarin. So therapeutic INR range for a patient who is taking warfarin, usually it's from 2 to 3. Sometimes we'll go more than that if the patient is really at risk for clot formation. What we have to do if the INR is too low? If the INR is too low, this means the patient is not taking the enough dosage of the drug, so he is at risk for clot formation, and we have to adjust the dosage usually by increasing it. What we have to do if INR is too high? This means the patient is at risk for bleeding, and we have to adjust the dose, decrease it, or hold it for 1 or 2 days and monitor the INR. We have to be familiar with, for us as a nurses, with antidote of warfarin, which is vitamin K. This keep it always in your mind. Antidote for warfarin is vitamin K. Also, another responsibility for us as a nurses, we have to administer the medication every day. Usually it is given orally. We will not give it as intravenous or intramuscular. It always coming as a tablet. It's orally given only. Usually we are giving it evening time. This medication usually will take 3 to 5 days to start working. Therefore, we have to keep during this time our patient on heparin infusion until the INR become therapeutic. We have also, as nurses, avoid IM injection, because remember, this patient is at risk always for bleeding, and he may bleed easily. So if we ask ourselves, what is the common side effect for warfarin? The common side effect for warfarin is easily bruising and bleeding, as we discussed before, nausea, vomiting, stomach pain, bloating, also altered sense of taste. So what we have to educate our patient who's taking warfarin, we have to educate them about to monitor the sign and symptoms of excessive bleeding. We have to educate them to use soft toothbrush and electrical razor to prevent any injury. Also, we have to educate them to avoid contact sports, because also it will cause injury. We have to educate our patient to tell their caregiver that they are on warfarin, especially prior to any procedure or surgery. Never over the counter supplement without speaking with your MD, especially aspirin, non-steroidal anti-inflammatory drug, or health supplements. We'll need regular blood tests to measure the BT, INR, CBC, and renal and liver function, so we can adjust the dosage of medication according to them. If the patient has accidentally has an accident that causes bleeding, we have to educate our patient to apply firm pressure for a prolonged period of time to prevent the continuity of bleeding. Also, if, we have to tell our patient he should not consume alcohol, because consuming alcohol, it will interfere with the effect of warfarin. We have to educate our patient also to eat normal diet, but avoid excessive amount of food that high in vitamin K, because special example for that, green leaf vegetables, because this will decrease the INR. Also, we have to educate our patient what they have to do if they missed a dose of warfarin. We have to tell them take one, remember, if on the same day. If remember the next day, skip the dose and take the next dosage at the scheduled time. Write down the day that you missed the dosage and inform your MD. Remember, don't take an extra dose if missed. So we reached the end of our review for today. This is an example of NCLEX question. If we go through it, what is the antidote for warfarin? This information we mentioned already in our review today. So I need you to write down your answer in the comment below this video. Please don't forget to like and subscribe to our channel and share it also. Looking forward for your support. Thank you for your listening. Please wait me in coming review also.